Olympic Community of Health is a nonprofit in the Olympic region, which includes Clallam, Jefferson, and Kitsap counties and 7 tribal nations. We prioritize collaboration across the region, tackling health issues no single sector or tribe can tackle alone. This video series brings bite-sized conversations addressing local health challenges directly to your screen. We invite you to grab a cup of coffee or tea and join us as we dive into today's topic. Health is more than healthcare. It is estimated that 80% of our health is shaped by social conditions. These conditions are often referred to as the determinants of health, defined as the conditions in which people are born, grow, work, live, and age. Determinants of health are categorized into 5 groups: economic stability, education, social and community context, neighborhood and physical environment, and health and healthcare. Everyone's health is shaped by their social conditions. At their best, social conditions can improve health, such as through safe, affordable housing, access to good education and healthy foods, and sustainable income. At their worst, social conditions negatively influence health, well-being, and life expectancy. Adverse social conditions create risks to health, such as housing instability, inconsistent access to food, exposure to violence, and unstable social relationships. Communities have long understood the importance of social conditions in shaping health. Additionally, there is a growing focus in healthcare to move towards care systems that integrate health and social care. 2 examples of local partners addressing determinants of health are Olympic Community Action Programs and Kitsap Children's Clinic.
I am Shannon Ray. I am a nurse and the clinic manager for Kitsap Children's Clinic, and I am having a peppermint mocha.
I'm Kathy Morgan, and I work for Olympic Community Action Programs, which is a community action, which is nationwide. And I am the housing director, and I'm drinking black
Hardcore.
coffee.
I'm curious, in your line of work, how do you see the impact of social determinants of health?
That's a big question, because it really depends on the person also, right?
Absolutely.
What are the needs? How could we meet all of those needs? Whatever they need help with, whether it be medical or housing or energy assistance or food or transportation. We even do car repair. Whatever it is that help people just maintain their day-to-day, and so they can get through the next day and all of their needs are being met. To me, that's determinants of health. And everybody deserves to have a long, full, enjoyable life, because doesn't that build community?
It does, absolutely.
In your industry, why are determinants of health so important to you?
Determinants of health have a long-term impact on everything in a person's life. So someone who is born into a family with money, who's never had to worry about food, shelter, education, transportation, their likelihood of success and longer life will ultimately, be a positive experience for them, as opposed to somebody who happens to be born into poverty. Their parents struggle, with getting them resources that they need. They're just trying to get as minimal food on the table as possible to feed them. They're going hungry. There's no transportation to get to good jobs, so they have to take whatever they can. In some cases, depending on what job is available to them, it may cost them medical insurance that they would get through the state. And so they're just surviving on minimal resources to keep themselves alive, which will ultimately impact them. It's the simplest thing. Knowing you have someplace safe to live, knowing you have food to eat, knowing you have the ability to get yourself to a job or get yourself the education you need determines the quality of life that you are going to have and how long that life is going to be.
I know a lot of our folks, if they have no housing, they're not going to take care of their medical needs. As a matter of fact, most of the time they don't even know that there is any medical needs because they have been living on edge for so long and just in that survival mode. And it's not until we actually house them and they feel comfortable in their own housing that all of a sudden all these things kind of show up, right? That have always been there, but it was just never addressed, or, I guess needing food and shelter were primary.
Meeting people's basic needs, healthcare, food, shelter, education. They all are connected, and so we need to shift away from that mindset of, well, that's a different department, go find that. No, you need help, and I'm here to help you, and let's help connect you. And I agree, that is one of the things we've made so many improvements within our office just from the connections we've made with OCH and the benefits that we're providing to our patients, and I want to see that grow.
Well, not only, but to take it one step further, right?
Yeah. Oh, absolutely.
So not just the referral piece of it, but being able to work as partners with that one person. So being able to, I don't really need to know, a lot of medical stuff going on, but those conversations need to happen.
Yes.
So, for example, any of the people that we're serving, any of our customers that come to us, we build, because we can do that over a long period of time, right?
Sure.
So the first thing we do is build trust with them. We do end up with a lot of information that they feel that they can trust us by telling us these things. So I may know more about what's going on medically with this person than what they're going to tell their medical provider. And so by having us talk to each other, I think it's better for the customer, because they don't even sometimes know what to say or what to ask for. So what if somebody referred a patient to you, a youth, and you found out that this youth their family was homeless, maybe living in their car or in a place not fit for human habitation, and there was some food insecurities, what would you do?
So we do routine screening of social determinants of health as part of our well care, and then equally just assessing anything when a patient comes through the door. Do they have additional needs? So it is not uncommon for us to come across a need of that nature. We do our screening in the form of a questionnaire. There is something to be said about being able to just mark a box and continue on, as opposed to having to say, no, I don't know if I'm going to eat tonight. That's probably a lot harder to tell somebody. Where can we break that cycle? So if we're checking these things, and we start checking them very early. I mean, we do postpartum screens on new moms when they're coming in for visits. Is there, something that we need to intervene here? No, that mom is not our patient, but that family is our patient. Right. So that mom's ability to care for that baby impacts that baby's life. So in caring for them, we have to look at the big picture. There's definitely that level of insecurity where, I don't want to be judged. I don't want someone to think that I can't care for my child. We're, and it is important for us to build those relationships and help people understand we are not here to make this harder for you. We want to help you solve some of these problems. We want to be part of your team. And so it does take a village. And so the team can be us, you, so many other limitless resources that are out there that we are just not tapping the potential of. And then our community, our customers, our patients, we should all be one unit and not just butting against different systems and saying, well, go find this, or here, this is a good person to check out, give that a try. No, how do we help them? How do we communicate these things and say, okay, I'm seeing this, is this something you can help them with? And then you're feeding that back. And I love that idea. And I think it's totally a doable system. We just all need to keep connecting with each other and having that same priority of putting the needs of the patients first.
Olympic Community Action Programs and Kitsap Children's Clinic are just two examples of the many local groups addressing determinants of health across the Olympic region. There is no standard playbook of how to best improve social conditions in a community. OCH has taken the first steps in creating an inventory of local projects addressing determinants of health. By visiting our website, you can access this inventory. The tool aims to build situational awareness and provide creative examples to inspire future projects. For example, the Mariposa House addresses housing on the west end of Clallam County by providing temporary emergency shelter for those fleeing domestic violence. Bremerton Food Line provides 3 to 4 days worth of food for a balanced diet to low-income community members. The Ecumenical Christian Helping Hands organization provides volunteer medical transportation and assists with shopping and errands across Jefferson County. Explore the inventory and check out several of OCH's reports to learn more about determinants of health. These resources can be found at olympic.ch.org.